This is a presentation showing how the health belief model could be enhanced by motivational interviewing by Lindsay Porter. First, look at the health belief model, and we know there are 6 constructs that need to be in place in order for someone to be ready to act. And first off, there needs to be a perceived susceptibility. The client or patient needs to feel like they are susceptible to a disease or illness. They also need to think that the conditions could be severe if they don't make changes. They also need to be able to perceive benefits, potential good outcomes of making changes, and also weigh those against perceived barriers and their ability to overcome these barriers. They also need to have a cue to action or certain triggers that can help them kind of propel them towards this action. And underlying this whole model is the idea of self-efficacy. And this is where the client or patient has the self-confidence in their abilities to actually make and sustain change. We look at motivational interviewing. First, talk about the spirit of motivational interviewing. This involves a partnership, acceptance, compassion, evocation. All these things need to be in place. And the partnership is especially important in helping the client feel that they are a part of, that there's a mutual respect there. It isn't the provider trying to tell the client what to do, but more an active role coming from the patient in making their own decisions and deciding what they'd like. Also, acceptance needs to be in place. The client needs to feel accepted that their efforts and experiences, their strengths, all that they've done is acceptable, and they're acknowledged and their self-worth is appreciated. There also needs to be some compassion. The client needs to know that their welfare is of most import to the provider, and that all will be done that will be in their best interest. And also there needs to be this idea of evoking the wisdom and experiences from the client themselves. When they can hear themselves and can recognize those things that they would personally like to change, that can help propel change as well. So 4 principles of the motivational interviewing include resisting the righting reflex, understanding and exploring motives, listening with empathy, and empowering the client. So being able to refrain from judging right away and being able to really listen and understand and try to figure out what it is that the client really desires and is willing to do and wants to do. And also listening with empathy, being able to see things from the client's perspective and objectively find those things that would be most helpful to them. Also empowering the client and helping them with their self-efficacy and giving them the skills that they can use to actually make some changes. Another important part of motivational interviewing is change talk, and this involves any type of discussion or questions, statements about desire, reason, need, ability, and commitment. So anytime the patient brings up any of these topics or questions are asked about these are all things that are helping a client move from sustained talk to change talk. And as this happens, there's a lot of statements about ambivalence. Ambivalence is what the change talk is hoping to resolve. So as they can move from sustained talk to change talk, clients are able to work through this ambivalence. When we look at how motivational interviewing could be used with the health belief model, we know that motivational interviewing helps strengthen self-efficacy. It also helps enhance many of the constructs of the health belief model. And the motivational interviewing also, as we mentioned, helps resolve ambivalence, which is important in the health belief model. So we take a closer look at how motivational interviewing strengthens self-efficacy. We can see this in the spirit of motivational interviewing to begin with. When the patient feels accepted, they feel like their best interest is in mind, they have this mutual partnership and their own experiences and wisdom is being drawn out, they have a stronger sense of self-efficacy and also confidence to make changes. This all creates an unconditional positive regard, which if they aren't feeling pressure and aren't feeling judged, they may be much more likely to want to make changes and do things on their own initiative. They also will develop a greater sense of self-worth and be able to see their capacities to change, and also understand that they have the autonomy, they can make these decisions on their own, and they have the responsibility to do so. As we take a closer look at how the change talk of motivational interviewing compares to the health belief model constructs, we can see that desire, reason, and need closely parallel the susceptibility and severity of the health belief model. Things like, I want to feel better, I need to stop drinking, or my blood pressure is high, all those things are kind of fall under both categories. Also, we can compare ambivalence in the motivational interviewing change talk to the benefits and barriers that are part of the health belief model. And things like, I'd love to change, I really want to, but I don't have the time, I'm not sure it's worth it to make these sacrifices. And then also the ability and commitment that's touched upon in the change talk also correlates closely with self-efficacy in the health belief model construct. So things like, can I do this? And I think I could, I'll start. All those things all correlate together, and as the provider walks the patient through the change talk, several of the health belief model constructs can arise and naturally come forth, and the patient can figure out what it is that they want to change and how they want to do that. And motivational interviewing, as we mentioned, also resolves ambivalence. And there is that ambivalence in the health belief model between the perceived barriers and the benefits. There's a lot of inner conflict between sorting those out. So the change talk helps first identify this ambivalence, and then helps the client explore their own priorities. And as they do that, the provider can selectively highlight statements that are in the direction of positive change to help resolve this ambivalence as the client works through the health belief model. So there are some conflicting and complementing differences between the health belief model and motivational interviewing. The health belief model, as we know, is largely centered around compliance. It's more geared toward informing the patient of things. It has a more traditional directing approach, with the provider kind of directing the client, walking them through all the constructs. It also is more centered around external cues or triggers in the environment, other people, other things that could maybe make the client change. Whereas motivational interviewing is more geared around internal cues and those things that come within that can help the client change. And it also is more client-directed. They're kind of more in control of the flow of the conversation, although the provider is also gently guiding the client through these. But those things that are brought up and talked about are largely coming from the client. And this also means there's more exploring and more understanding, rather informing, and then which leads to self-discovery and the patient's own decisions to make changes. So both these models are great in helping clients change, and other theories also are important and can strengthen and improve the client's self-efficacy. That can help them gain the skills they need to resolve ambivalence and to sustain lifelong change. Thanks for watching.